All right, today we're going to demystify a really incredible surgery that has completely changed the game for treating testicular cancer. It's called retroperitoneal lymph node dissection, or as you'll often hear it, RPLND. But this isn't just about a medical procedure. It's really a story about amazing precision, about a deeper understanding of the human body, and ultimately about hope. So let's start with some really, really good news. The story of testicular cancer treatment today is thankfully a huge success. When it's caught in the early stages and with the right treatment, the cure rate is nearly 99%. I mean, that's just staggering. It's one of the true wins in modern medicine. But, that incredible 99% number, that's for early stage disease. So the big question is, what happens when the cancer isn't just in the testicle anymore? This is where things get more challenging, and it's where the story of this specific surgery really kicks into high gear. Okay, so to understand the solution, you first got to understand the problem. We need to look at the exact route this cancer takes when it decides to go on the move. I want you to think of your body's lymphatic system like a massive network of highways. Well, for testicular cancer, there's a predictable superhighway it almost always takes first. It leads deep into your abdomen to a place called the retroperitoneum. This area is like a central station full of lymph nodes, and it surrounds your body's biggest blood vessels. It is, for all intents and purposes, the cancer's first stop. Now, you're probably thinking, well, can't we just do a CT scan to see if it's spread? And that's a great question. The problem is, our imaging technology is good, but it's not perfect. It can't see cancer cells if they're microscopic. In fact, studies show that our standard scans can miss these tiny deposits, which means up to a quarter of patients could be understaged. And that's a really dangerous blind spot when you're making a treatment plan. So if our best scans have a blind spot, how do you fight an enemy you can't always see? Well, this is where RPLND comes in, and it does something truly brilliant. It serves two purposes at once. So, what is it? At its heart, RPLND is a very meticulous, very detailed operation to go in and surgically remove those specific groups of lymph nodes. If we go back to our highway analogy, this is like physically clearing out all the key interchanges and rest stops where we know the disease is most likely to be hiding. And here's where that dual power comes in, and it's pretty remarkable. First, it's diagnostic. It tells you what's really going on. By looking at those removed nodes under a microscope, doctors get the most accurate information possible. It's the ground truth. And second, it's a treatment. For patients who just have a little bit of cancer in those nodes, this surgery alone can be the cure, like 90% of the time. It gives you the roadmap for what to do next, while at the same time trying to end the cancer's journey right then and there. But the story of RPLND isn't just about curing the cancer. It's also about a huge leap forward in medicine, which is preserving a patient's quality of life after they're cured. See, in the early days, this surgery came with a very high price. Because of where the surgeons had to operate, a huge number of patients, we're talking up to 90% in some of the first reports, lost the ability to have a normal ejaculation. And for young men, that was a profoundly life-altering side effect. And this image right here shows you exactly why it was so difficult. You see this delicate web? Those are the sympathetic nerves that control ejaculation. And look where they are, running smack dab through the exact area the surgeons need to clear out. For a very long time, it felt like a choice. You either get the cancer or you sacrifice these nerves. But then we had a breakthrough. Surgeons did some painstaking work, literally mapping out the precise location of these nerves. And using that map, they developed a revolutionary new technique. A way to identify the nerves, gently move them aside, and work around them, all without compromising the goal of removing the cancer. And the result? It completely flipped the script on the old outcome. Today, with these modern nerve-sparing techniques, up to 95% of patients who have this surgery for the first time will preserve their normal ejaculatory function. That is just a stunning achievement in medical progress. Now, 95% is incredible, but it's not 100%, right? So, just as a precaution, the standard recommendation for any man who might want to have kids in the future is to bank sperm before the surgery. It's just a really important safety net to have. So we get the why. We understand why this surgery is so critical. Now let's take a quick peek inside the operating room to understand the how. How is this incredible procedure actually done? First off, this is not a one-size-fits-all operation. It's incredibly precise. Based on whether the cancer started on the right side or the left side, surgeons use a very specific map, a template, to guide their dissection. The cancer's spread is predictable, so the surgery is tailored to that exact pathway. It maximizes how effective it is and minimizes any unnecessary surgery. Now, at the heart of this nerve-sparing surgery is a really elegant move called the split and roll technique. It's a very systematic process. First, they expose the big blood vessels. Then, and this is the absolute key, they find and protect those nerves before they start removing the lymph nodes. Then, they carefully roll the packet of tissue away from all the important structures it's touching. And look at this. You can actually see that crucial step in action right here. Those thin white string-like things being held by the loops, those are the actual nerves. They're identified and gently pulled out of harm's way before the main dissection even gets going. The level of care here is just astounding. And here you have it, the final result. The entire packet of lymph nodes has been taken out, but the nerves are left behind, completely intact and unharmed. It's the perfect outcome, the cancer is gone, and the patient's future quality of life is protected. Okay, the surgery is a success. So what comes next? Let's talk about the final chapter in this story, recovery and the path forward. This image is basically what a surgeon wants to see when they're done. The major blood vessels, the aorta and vena cava, are totally clear of tissue. The area behind them is exposed, which means the target is gone. And most importantly, you can see those nerves we've been talking about, preserved and ready to function just like normal. Recovery usually means about 5 to 7 days in the hospital. One possible complication is something called lymphatic leakage, but it's usually handled pretty effectively with just a simple low-fat diet. The long-term outlook, though, is fantastic. For patients who might need it, when you combine this surgery with follow-up chemotherapy, the ultimate cure rate can soar above an incredible 98%. You know, a quote from one of our sources really sums it all up perfectly. It says that RPLND plays a critical role in the staging, prognosis, and treatment of testes cancer. It's not just one piece of the puzzle. It's a central pillar. It defines the problem, predicts the outcome, and treats the disease. It's absolutely essential to getting these amazing cure rates. So we end with this thought. The evolution of RPLND really proves that the path to a better cure isn't always about being more aggressive, it's about being more precise. It's just a powerful reminder that by having a deeper understanding of our own body's map, we can turn a once life-altering procedure into a truly life-saving cure. Thanks for joining us for this explainer.